Hi, I'm Brenda Kopriva. I'm a general surgeon at Colby at Citizens Medical Center. Regular breast cancer screening is about finding things early. 1 in 8 American ladies will get breast cancer, and 1 in 8 is a lot. Mammograms are the gold standard for screening for most women. Mammograms should start around the age of 40 and then should go either yearly or every 2 years. Kind of depends on which recommendations you're following, and that could be a discussion with your primary provider. I'm admittedly biased because I treat breast cancer often, and I think that yearly mammograms starting at the age of 40 is the best recommendation to follow. There are some women that would have to start a little bit earlier than that, a woman that had family history of breast cancer at an early age. Generally speaking, they should be at least conscious of it or aware of it 10 years younger than your youngest family member. So if you had an aunt that had breast cancer at 36, you want to already be thinking about what you're going to do preventatively by the age of 26. If you notice a difference, if you feel a change in your breast, such as a lump, or you have a nipple discharge, or an inversion of the nipple, or a skin change like a dimpling or a rash, you should pay attention to that. They're not necessarily all going to be something concerning, but I ask ladies to pay attention to changes and then bring them to a provider's attention if they persist. There are plenty of reasons why people put off mammograms. We're all busy. There's always something else to do. And there are some ladies out there that have found that it was an unpleasant experience. And what I would encourage those women to do is, number one, make it a priority. Make yourself a priority because your health needs to be a priority before you can prioritize other people. And then number two, if you're one of those women that had a bad experience, don't be afraid to speak to the radiology department about that. Tell the mammography technologists what they can do for you or what your experience was previously. And it is amazing in how much that can help them then make this experience different for you. So the take home there is don't give up on mammograms. Find a way to fit it in your schedule and come back to it to be preventative. Routine mammography is about finding things early. And a lot of people worry about getting a mammogram because they worry maybe that they'll have to have more imaging, or they've had more imaging in the past, or that they'll have to have a biopsy. And the statistics would show that about 10 out of 100 women will get a call back for an ultrasound or a further imaging on the mammogram. I encourage women to follow through with mammograms even if you've had callbacks in the past, because 10% of you will need callbacks. Most of those will be okay. 2% of you will need biopsies. Most of those will be okay. But what I really ask women is not to give up on the process, not to get exhausted by the process, because that's where we get into trouble, is you wait 2 or 3 years because you were frustrated last time, and then we come in 2 or 3 years too late. I get the question of what age should we stop mammograms? And that's a very individualized question. But the truth is that the majority of women, if you're in good health, have a good life expectancy, would want something done if you found something, and are on the same page with your provider, can continue doing mammograms far into 70s or even 80s. There's no right answer for what age we stop mammograms. The right answer is when it's right for that person. And so I encourage women to make that a part of your conversation with your provider on a yearly basis.